Hi, this is Dr. Alboslu from Concord, California. Last week we talked about what you can do to be able to fall asleep. It's normally known as recommendations for sleep hygiene. A very important recommendation, and if you follow with them, it definitely helps you. However, another question I keep getting is that we went to the sleep doctor and he did a bunch of different things, but didn't give me any medicine for sleeping. In order to see what a sleep doctor does, we have to understand what are the underlying processes that a sleep doctor would like to address so we get the sleep better. So these are different mechanisms or conditions in the brain that can cause a situation that we cannot get to the sleep because of pathology, because something is wrong that might not be wrong with somebody else. So this is the condition that, for instance, I have as a patient or another patient might not have. Before getting to these conditions and see how they affect their sleep and why we have to treat them instead of just giving a sleeping pill, I would like to remind the listener that if you do not give yourself enough opportunity to fall asleep or enough bedtime opportunity, then you're going to be sleepy because the brain loses its sleep. And if you don't have enough sleep or insufficient sleep, then there is nothing we can do to make this brain feel time. So normally we want to get 7 to 9 hours of sleep as an adult. Sometimes less, sometimes more, but that's an average. So if you're sleeping 6 hours, 5 hours a night and wonder why are you sleepy, here is a good thing that you can fix first. Look into the amount of sleep and the opportunity of the sleep that you're giving to yourself. Nowadays life is very fast-paced and people feel that they have to get ahead and they do a lot. And in the middle of doing a lot, they feel tired and exhausted and they don't know why. And a lot of time the answer is that you're not sleeping enough. Maybe a best first step is to make sure you're sleeping enough. Another issue is that if you sleep so much, that is also not good for you. So you have chronic insomnia. Come to the doctor and you say, "Doc, I cannot sleep. It's a while I can't sleep. I have a problem, help me." And of course, insomnia by itself is a condition that has its own measurements or measures to be treated, and we always want to help with that. But there are more important underlying conditions that can cause that insomnia, and the doctor is worried for those. One of the most common ones is the sleep apnea that in the last few years has been popularized in the social media and through the Hollywood and actors and athletes. So there is some knowledge about that. That's when we go to sleep, our breathing becomes problematic and we don't breathe right. Maybe 50 years ago, it was more of an object of fun and people would say so-and-so snores in their sleep and it's funny, but nowadays we understand that a lot of these snorings are actually something that is not good for you and you have to avoid if you can, or you have to go to the doctor and get it fixed. Another type of the sleep disorder breathing is central sleep apnea that also can cause insomnia. That is a more worrisome disease and it's harder to treat, and it also has more association with cardiac pathology. That's when the brain forgets to tell that. So obstructive sleep apnea is when you have too much tissue around here in your neck, and when you fall asleep, the tissue becomes lax and the breathing routine gets interrupted. But in central sleep apnea, what happens is that the brain forgets to tell the body to breathe. Both of them cause an alarm signal inside the brain, and the brain wakes up from the sleep momentarily and fixes whatever mechanism that it has to fix. So it ensures the breathing. After that, you fall back to sleep. This can take a few seconds and you have no memory of it. It can generate a very, very vague and short memory of a snort and just a little movement in the sleep, or it can cause a major awakening and you wake up and not fall back to sleep for 30 minutes. So all of them, when it happens on and on and on in the night, it gives us a situation that we are not able to stay asleep. and that causes the symptom of insomnia that is really caused by something else. Problems inside the brain and the problems of the nerves can both cause issues related to interruption of the sleep and fragmented sleep, that the patient feels it has insomnia and inability to stay asleep. Examples of that are narcolepsy, that the brain loses the ability to ensure the sleeping is continued. There's hypoventilations when the body doesn't breathe enough over some time, that the chemicals of the body get deranged, and also the brain again has to wake up and fix things. An array of neurological and medical condition can cause insomnia. For example, if somebody has pain, if somebody has shortness of breath, if somebody has anxiety, if somebody has degenerative brain conditions like Parkinson, let's say, that changes the chemicals inside the mind. All of these can cause insomnia. Shortness of breath can be seen in asthma, in COPD, in the smokers, or for instance, somebody who has congestive heart failure. The other issues that I want to mention quickly here is the problems that arise from the diurnal day and night cycle changes. For example, we all know teenagers have a tendency to sleep later and wake up later, or maybe elderly have a tendency to sleep sooner and wake up in the middle of the night. However, since that is not consistent with social activities of other people, that can also coexist with some complaint of insomnia as a symptom. Other examples of the same issues are jet setters, people who travel across the oceans a lot or across the time meridians, and also the shift workers who don't have a daytime 9-to-5 shift and work different shifts over different days. They also can develop something that is called shift work disorder. One of the symptoms is insomnia. So when you go to the doctor and say, I can't sleep and I want a pill to sleep, yes, it can be an issue by itself, but in a lot of cases it's an issue that is a symptom of another pathology, and in some cases it can be both. Insomnia as a condition and insomnia as a symptom of other condition, that they can be intermeshed and cause an end result of complaint of insomnia, that the sleep doctor has to take them, dissect them aside and find what is what, and for each one of the problems, how we can fix it. And just a simple pill in a lot of cases is not the correct solution. In the next video, I will talk about strategies that we can apply to help the patient with just the condition of insomnia. That includes a lot of pharmacology and different pills that are available and classes of the pills. So if you're interested, you can look at that video too. But at this point, I can tell the listener that most of the time a pill is not answer, and we have to change the lifestyle and find the other pathology that most of the time are more important and dangerous to the health of the patient, rather than just to give a pill to control the symptom. And I have to say that these medications a lot of time are not good options for long-term use, and there are sometimes that there are good options for long-term use and they lose their effect and the patient needs more and gets to the point that nothing works. I think over time I will caution multiple times about Tylenol PM. Obviously this is a trademark. Please look at the direction of the medication when you take it. I had multiple patients that took Tylenol PM a lot. It went to the toxic dose, and it can be pretty dangerous medication when it gets to the toxic level. You have to always consult with your doctor, use directions for over-the-counter medication so you avoid over-medicating yourself. A good rule of thumb is 99% of the time you don't want to take more than one Tylenol PM in the night. Heal your night, live your life. See you next time.